And now to the health sector, and this time the Lagos State government says it has deployed digital innovations to deepen its malaria and tuberculosis elimination across the state. The State Commissioner for Health, Professor Akin Abayomi, made this known at an event in Lagos, which also featured the launch of community-based molecular TB diagnostics aimed at closing the 66% detection gap in the state.
Lagos State top government officials from the Ministry of Health, national program leaders and private partners in the health sector meet in Ikeja, Lagos to advance a dual elimination strategy targeting malaria and tuberculosis. The conversation is focused on eradicating malaria and expanding tuberculosis diagnostics through digital innovation.
We knew the private sector was where many people first went when they had a fever. But testing was uncommon. Communities often assumed malaria was more prevalent than it was. And for those who didn't have malaria, many were taking medicines they didn't need while delaying the care that they did. We set out to change that by training staff and using technology to support quality assured testing and treatment in real time. Working together, we reached over 75,000 patients. We proved that rapid tests can deliver accurate diagnosis through the private sector. And because of our efforts, Lagos now qualifies as a malaria elimination zone.
The State Commissioner for Health, Professor Akin Abayomi, explains that two indicators such as malaria prevalence and malaria test positivity now guide policy decisions in the state. And since testing has become mandatory, positive malaria cases are down below 1% in March 2025, confirming that 95% of fever cases in Lagos are not malaria.
Lagos has launched the SHIP, the Smart Health Information Platform. It's been going now for a year. The idea behind the SHIP is that we're going to digitalize the entire public health ecosystem in phase 1, and in phase 2 we're going to push that into the private sector as well, so that as government, as policy makers, we will have the health-seeking behavior of our citizens in digital format, of course secure, so that we can tell at any point in time what the patterns, what the trends, what the instantaneous images of healthcare disease burdens are in the state. Very, very important for us as government to have access to this kind of data.
On the issue of tuberculosis, the Commissioner reveals that Lagos accounts for 9% of Nigeria's TB burden, with only 3,565 of an estimated 6,038 cases detected in the second quarter of 2025.
Lagos is going to be tackling these programmatic disease entities one by one to reassure you as the public that we're not just rolling over from year to year, trying to repeat the same programmatic interventions. We're really trying to come to the bottom of the narrative, to unpack exactly what's going on, to unpack the drivers of these diseases, and to ensure that we can put interruptions in space and ensure that Lagos can move our indices in the direction that we can all be proud of.
Other states are advised to emulate Lagos' data-driven approach to improve tuberculosis treatment and coverage.
I think as a country, and every state needs to be challenged, need to watch what Lagos State is doing. They have been able to, malaria is a very big problem, not only in Nigeria, but in sub-Saharan Africa. And it appears it's a mountain that cannot be surmounted. But we see Lagos demonstrating that this is doable.
The Lagos State Pathway to Malaria Pre-Elimination Project offers a practical, evidence-driven model for other states. It demonstrates how digital innovation, public-private collaboration, and disciplined surveillance can accelerate progress toward elimination. The National Malaria Elimination Program remains committed to supporting the adaptation, institutionalization, and scale-up of this model as Nigeria advances steadily towards malaria-free future. Thank you very much.
The Chairman House Committee on Infectious Diseases at the Federal House of Representatives and other speakers applaud the state for building on its malaria successes to scale tuberculosis diagnostics.
Nigeria continues to be ravaged by the ill effects of a greater burden of HIV, tuberculosis, malaria, and other numerous infectious diseases. And it appears why budgetary allocations and donor funds are being mobilized for the response against these health challenges. There seems to be no reprieve in sight for our country. It is against this background that the Lagos State government, ably led by His Excellency Governor Babajide Sanwo-Olu, must be commended for their leadership in steering the state to a free malaria state.
Tuberculosis, as we know, remains a leading infectious killer, while malaria, although lower than formerly thought, continues to account for substantial morbidity and mortality, particularly among children and pregnant women. Early, accurate, and accessible diagnosis is the cornerstone of effective treatment, prevention of transmission, and eventual elimination. So this dual elimination agenda reflects the commitment of Lagos State to integrated, data-driven, and community-centered healthcare delivery.
Delivering the key address on behalf of Governor Sanwo-Olu is the Secretary to the State Government, who reaffirms the government's commitment to strengthen healthcare system in the state.
Our goal is clear and it is bold. We are going beyond the present moment. We are building a stronger institutional framework, one that will endure beyond administrations, beyond headlines, beyond politics. Together, we will build a healthier Lagos State, stronger, safer, and unstoppable. And with the collective resolve of our people and you, our dear partners, we shall deliver a Lagos that is healthier, stronger, and future-ready.
The high point of the event is the unveiling of tuberculosis diagnostic scale-up, tagged End TB Now, signaling a new phase in the state's integrated disease elimination drive.
This is End TB Now!
Now we put our hands together for Mr. Governor. Thank you so much. Thank you.